Hello, everyone. I am Pastor O'Shane Winter. I want to welcome you to our first afternoon program, to the edification hour where information is power. And so we want to thank you all for joining us. We understand that you could be anywhere else, but you have chosen to be with us on this special hour on this beautiful Sabbath evening. And so with that, we want to welcome you to our program. I'm going to now hand it over to our elder, Ian.
All right, thank you, Pastor Winter. Now today promises to be a very informative session. We're going to be talking about men's health. And with us today, we have a very special guest. And the name of this guest is Dr. Lincoln Maynes. Dr. Lincoln Maynes is originally from the island of St. Croix, which is one of the United States Virgin Islands. He also went to the Atlantic Union College where he graduated. And that's one of my alma maters as well. So Dr. Maynes is a graduate of the Atlantic Union College over there in South Lancaster, Massachusetts. He also went on to University of Massachusetts, where he completed his medical degree. Then he moved on to Loma Linda University, where he did his residency program. So currently, Dr. Maynes is a urologist, and he works with Kaiser, which we all are familiar with. So again, Dr. Maynes, I just want to welcome you to this session. And now this time, I'll turn it over to you. Oh, quickly, before I do that, for those of you who are watching online, whether it's Facebook or on YouTube, you can post your questions in the chat, and we will make sure that those questions are being answered. At this time, we'll turn it over to Dr. Lincoln Maynes.
Great. Good afternoon. And thank you guys for joining. I'm hoping to get through a presentation here on some general aspects of men's health. I'm also going to try and be mindful of the time to allow for answering your questions. And I will begin by putting up a presentation. I'm going to share my screen here. Let's see, hopefully this. Sorry, having a little trouble here. Let's try that again. There we go. All right, great. Can you guys see that? Just some confirmation.
Yes,
absolutely.
Okay, great, awesome. All right.
Yeah, looking clear.
Sorry about that. So, today's presentation, I've done similar presentations on this general topic over the last several years. I have kind of partnered with the Men's Health Organization, a Men's Health Network, and they have provided me over the years with updated information and slides and so forth. So I'm actually sharing with you a presentation that they put together, the content, which is comprehensive in terms of some of the topics we're going to talk about. We're not going to go talking about things in too much detail, but hopefully enough that it provides some level of education for us, okay? So I'm going to scale through and just start with some men's health facts. So here are some facts that you may or may not be familiar with. So the current state of men's health. Now you'll see at the top, the life expectancy in 2014. It takes a while for them to accumulate data. And this is actually some data from the last couple of years. So it usually takes a while for them to accumulate some of this data. What is interesting though, before we jump into this is that, and I believe it was this past week or the week before, I'd heard a report about life expectancy numbers, especially in light of COVID-19. And one of the dramatic things that has been observed is that COVID-19 is expected, at least within, for Caucasians, to decrease life expectancy by probably at least 1 year, when they were kind of looking at the preliminary numbers. But for what's described as Black and brown populations, the life expectancy is actually, they predict, will lessen by 2 to 3 years. So it's actually quite dramatic in terms of the impact of COVID-19 on life expectancy. But in general, when we look at the numbers outside of COVID-19, we see here to the far left, we see life expectancy at 78.8 years. This includes everyone in the green. In the middle, of course, all females, and then we see all males in blue. So we see life expectancy for males in general lower than for women in general. When we break that up into more specifics with different populations, one of the things that we see here, if you go to the tall red bar, we see that Hispanic females actually lived the longest according to this particular time frame that they looked at. But if you look at almost all the way to the right, you see a green bar and it says Black males, and you see that life expectancy about 72.5 years of age. So a dramatic difference if you look at African American males compared to Hispanic males, white males, Black females, white females, Hispanic females. Across the board, African American males have a lower life expectancy. In fact, I know one of my colleagues had mentioned he was privy to some data some years ago, and I remember him giving a presentation because he was privy to some of the data coming out of LA County. And one of the things that they had found was that life expectancy in actually LA County, that Asian women had the highest life expectancy, and the lowest life expectancy was, again, African-American males. When they factored out, using statistics to factor out certain things as in their calculations, even controlling for certain factors, still African American males died at younger ages. So it's actually quite interesting across the board. So men are half as likely to see a health provider for a physical exam compared to women. Men are more likely to be uninsured than women. And men are dying at higher rates than women for 9 out of the top 10 causes of death in the United States. I apologize for showing a ton of data, but I won't dwell on this too much, just to give you some general information here. So if you look at all the way to the left side of the screen, you're going to see, and you look actually at the bottom of the chart, you're going to see different types of medical problems. See heart disease, malignant neoplasms or cancers, chronic lower respiratory diseases, accidents, cerebrovascular disease, meaning stroke, Alzheimer's disease, diabetes, and so forth. Well, when you look at the chart here, you see at the top of the bars, you see some numbers. Well, those are the numbers per 100,000. So when they put up these statistics, they usually present them in whatever number per 100,000 people. So what we see here, which is interesting, is we see in the far left, again, the 3 bars that are together, we see a number 167. Well, that's the death rate for both sexes for all ages. So 167 per 100,000 heart disease in general. But the red actually indicates the death rate for males. So 210 people per 100,000. And then we see the death rate for females for heart disease, 131.8 per 100,000. So again, you see a dramatic difference there in heart disease. Well, you see similarities with cancers, Then you have chronic lower respiratory diseases. You see that a little higher there. Again, men. Accidents, men die at higher rates per 100,000. And then for strokes, we see some leveling off. Alzheimer's disease, a little less in men. Diabetes, a little bit more. Influenza, pneumonia, maybe a little bit more in men. Kidney issues, and intentional self-harm, which is very high in men compared to others. There's some additional numbers here. Again, this is showing numbers per 100,000, but it just kind of breaks it down here. Again, heart disease, cancers, lower respiratory diseases. You can see for males, which is that middle column, that the rates are higher compared to the column to the right, which are numbers for the incidence in females. So cardiovascular disease. Well, approximately 450,000 men die of cardiovascular disease each year. And it is the leading killer of men and women, actually, among all groups, all ethnic groups. Approximately 1 in 3 adult men have some form of cardiovascular disease. A man suffering from cardiovascular disease may also have erectile dysfunction as a symptom. And being a urologist, I do see men coming in with those issues. So it may be an underlying, issue, and probably signaling to us that, this man may have some underlying cardiovascular disease. So it is one of those things that we do see. So as we look at, again, these charts here, see the incidence of cardiovascular disease by age and sex. And we see as men and women get older, there's a higher risk of cardiovascular disease. But again, we see the rates are higher in men compared to women. And the incidence in the lower chart, the incidence of heart failure by age and sex. Again, the older you are, the more likely you are to have some issue in regards to heart failure. But we see, again, the rates are higher in men. Now, I should say that, this of course presentation is sort of geared to men, but the women who are listening in, who have logged in, you have men who you love. So this is good information for you as well, because it can help you help them in regards to their overall health. So what about diabetes, right? Again, we're not going to talk about it in lots of specifics. I'm just going to give you some general information. So diabetes is a leading cause of heart disease, strokes, kidney failure, blindness, and amputations. So about 12 million American men aged 20 years or older have diabetes. 12 million men. So diabetes affects the body's ability to turn food into the energy, source that it needs in order to function. So diabetes contributes to the deaths of over 200,000 Americans each year. People with diabetes are more than 2 times as likely to develop heart disease or die from a heart attack. In fact, we have patients who, and I had a patient within the last month and a half that he needs to have surgery, but his diabetes, it was newly diagnosed diabetes, and his diabetes are so out of control that we have to postpone his surgery until we could get his diabetes under better control, because he has high risk for having complications going under general anesthesia. So it is significant. People diagnosed with diabetes have medical expenditures that are 2 to 3 times higher than patients without diabetes. So, consider this, where you have underserved populations who could be financially strapped or stressed. You don't have a lot of residual income to spend on medical care, yet folks who have diabetes in those populations, end up getting stuck with a lot of medical expenditures, 2 to 3 times higher than patients without diabetes. So it does have a huge financial impact. So a man suffering from diabetes also may have erectile dysfunction as a symptom. So what about cancers in general? So according to the American Cancer Society, the approximate lifetime risk of developing cancer is 1 in 2 for men. So there are over 310,000 cancer-related deaths in the United States each year in men. Over the course of a lifetime, 1 in every 2 men and 1 in every 3 women will get cancer. It's unfortunate, but those are the numbers. Prostate cancer, which is a disease that I treat actually on a regular basis. Prostate cancer is the most common cancer in American men. Lung cancer is the most common fatal cancer in American men. And, cancer can strike anyone at any age. But the majority of cases we see are men that are 55 years of age and older. Well, what about prostate health? Prostate health. So, prostate and skin cancer continue to be the most common cancers in American men in general. So, BPH, or we call benign prostate hypertrophy or prostate enlargement. And it's something that we see commonly in my specialty. And what it is a progressive condition that leads to sometimes frequent urination during the day or at night, a decreased stream. So you feel like, man, it's getting more difficult to empty my bladder. Difficulty or pain while urinating, or a feeling that you're not really emptying your bladder quite well or completely. So this typically affects half of men over the age of 50, and it affects about 90% of men by the age of 80. Less than 50% of those men are diagnosed. So they're guys who just, they just think it's just normal. And it sort of gradually has happened. And so they don't necessarily seek any medical care. They just, I can deal with it. And so less than 50% of men are diagnosed. And then less than 20% of men are actually treated for this. And it can actually have a significant effect on your lifestyle, especially, and this could lead to some people getting up at night, as I mentioned, and that could be for a variety of reasons, but could be related to this BPH. And, getting up through the night, sometimes you're not able to get a good night's sleep. And so you're not as productive the next day, or are, extremely tired and fatigued, which could affect you, on a daily basis. So what about prostate cancer? Prostate cancer is the most common cancer in American men. Younger men may be more likely to have an aggressive form of prostate cancer. 1 in 7 men born today will be diagnosed with prostate cancer in their lifetime. And more than 160,000 men are diagnosed on average, each year. Approximately 27,000 men die from prostate cancer each year, and African American men are at increased risk for prostate cancer. There are different reasons that people propose for this. Some mention, genetics may play a role. A lot of it is access to what some people have looked at is perhaps access to healthcare, and even those who have maybe not having insurance, having access to healthcare. Some may not be screened necessarily for prostate cancer, and there may be some who have been screened or maybe diagnosed with prostate cancer, but for whatever reason decide not to go on to treatment, or maybe certain things aren't suggested in regards to treatment. So that's what some of the research actually is suggesting. And then there is prostatitis. Prostatitis is really just an inflammation of the prostate that may be caused by an infection. And that's something that we see occasionally. It could be quite bothersome for some men, but that is another condition of the prostate that we can see. Talk about prostate cancer in a little more detail here. So again, prostate cancer and skin cancer continue to be the most common cancers in American men. So when we look at the numbers here, and there's a little discrepancy here, and I didn't get a chance to go back through because I wanted to see where they're pulling actually some of the numbers from. But we see here, the rate again is, per 100,000. So Caucasian males, 19 per 100,000, and that included Hispanics, but non-Hispanic Caucasian 19.2 per 100,000. But look at Black males, and it says that includes Hispanic. You see the number is 44.2 per 100,000, that's significant in terms of the numbers. Well, what about testicular cancer? Well, that's another disease that I see my specialty. And testicular cancer is the most common form of cancer of men between the ages of 15 and 39 years of age. So it's a disease of young men. It's rare that I have treated a man older, I would say, from this age group with testicular cancer. So what are some of the risk factors for testicular cancer? Well, somebody may have what we call an undescended testicle or a history of undescended testicles. So when a young man is born, over a period of time, the testicles descend down into the scrotum, into the sac. And typically what happens, of course, the child is taken to the pediatrician for well checks. The pediatrician will do an exam just to check and make sure that the testicles are there. And occasionally there's a baby or a toddler that they may not feel a testicle within the sac. And those babies, toddlers, get referred to urologists or pediatric urologists in most instances to kind of evaluate things. So if the testicle doesn't come down by about a year of age or so, it is usually recommended that we surgically actually bring the testicle down. So we try and find it and bring it down. So those men who have a history of undescended testicles are at increased risk for developing testicular cancer, and it has to just do with perhaps some hormonal things, perhaps things in regards to temperature, where the testicle was sitting for a period of time before they were brought down. All those things are some theories in regards to why they're at higher risk. A family history, if you have a family history of testicular cancer, you're at higher risk. White males are more likely to get testicular cancer than Hispanic, Asian American, and African American men. There's some other potential risk factors. Testicular cancer is less common among older and middle-aged men, as I had mentioned earlier. So what about sexual health? Sexual health. So, your sex life is a reflection of your overall health. So the healthier a man is, the better his sex life will be. And I've mentioned erectile dysfunction several times already because it is significant. And it is caused by heart disease, diabetes, certain medications can lead to this, lifestyle or other problems. About 30 million American men experience erectile dysfunction. That number actually may be underestimated. Of course, I mentioned cardiovascular disease and diabetes are really a major thing. So if you think about it, if if one were to live a healthy lifestyle where you decrease the risk of heart disease, decrease the risk of diabetes, you wouldn't need to be on certain medications, and your lifestyle was a certain way, the likelihood of erectile dysfunction is low. Sexually transmitted infections, or we call it STIs or STDs. And so, whoops, sorry, I tapped on the screen here and advance the slide. So the more sexual partners one has, the greater the risk of getting a sexually transmitted disease. I see young men occasionally, and I go over this with them. And unfortunately, there is some increased incidence in certain things that we see, even with my head and neck colleagues. They're seeing increased risk of actually head and neck cancers in younger people related to sexually transmitted diseases. In some of the populations that they see. So over 19 million new cases are diagnosed each year. Of course, HIV, AIDS, chlamydia, gonorrhea, syphilis, and others.
Hey, Doc, for the sake
Yes.
of our audience, can you perhaps explain what head and neck cancer may be?
So so head and neck cancers are any cancers that are occur in the mouth, in the tonsils, in the back of the what we call the pharynx, which is the area when you swallow that fluids go through. And there are certain cancers where a long time ago, so they're seeing a little bit of a shift. And this is one of my colleagues had been sharing this with me over the last few years, where before head and neck cancers, and this is what we call typically what we'll call a certain type of cancer, we call squamous cell cancers and other things that can occur in the mouth. Well, those can develop and spread to lymph nodes in the neck and so forth. And so when those patients come in, I mean, it's going to be really dramatic surgeries and treatments that some people have to go through. And it used to be a disease, and they still see it in older men who smoke and so forth. But again, seeing it in some younger individuals because of viruses related to certain STDs. And so that is an unfortunate thing. And in the past, some of those treatments require really dramatic surgeries or radiation to the head and neck area, which could be very significant, very significant. So what about mental health? Mental health. Again, I'll just trying to cover some general topics in regards to men's health, mental health. So mental health is psychological well-being and satisfactory adjustment to society and to the ordinary demands of life. Now, over the last year with COVID-19, and even if you excluded COVID-19, we would still have stress, anxiety, and issues of depression. In the past year, I would say that this has increased dramatically, probably across the board. What are some of the factors affecting your mental health? Well, the death of a loved one. A lot of people have faced that in the last year. Divorce or separation, loss of employment, significant over the last year. The birth of a child. Well, that for some people could be good, and some it could be some other level of stress because you're worried about certain things in regards to that, right? Being diagnosed with a serious illness, like some of these illnesses that I just talked about, that could increase the level of stress, anxiety, and depression. Moving to a new job or home, can be stressful. And natural disasters, depending on part of the country that you're in, here in California, certain times of the year, there are wildfires. If you live in certain areas, it is very stressful. And in the last 2 years has been significant. There's been a significant loss of life and property in regards to that. You live in certain coastal areas back east. I mean, you deal with hurricanes. I mean, wherever you go, there is some, there's tornadoes, there are blizzards, there are all kinds of things that can increase the level of stress and anxiety and depression. And your genes, genetics. I have, a patient who has had at least 5 or 6 different cancers, completely different cancers that he's had treated over his lifetime to this point. And genetics has to have some role in that. So depression. Depression affects nearly 19 million American adults. It is underdiagnosed in men, probably for different reasons. Men are just as likely to be depressed as women, if not more so. Men are 4 times as likely to commit suicide than women, 4 times as likely. Without treatment, symptoms of depression can last weeks to months or even years. And depression is the leading cause of disability in the US, sidelining more people than back problems, heart disease, or even injuries. So it is significant, and it can go undetected, and it may be somebody that maybe even a really good friend or even your best friend, and you have no idea. And that's why this is one of those things that we should be mindful of, because many people are surprised when somebody we know commits suicide, and everybody's wondering what happened. Well, depression unfortunately has a lot to do with many of those cases. What about stress symptoms? When I was looking at this list, I was like, I may have some stress here. So the most common symptoms include headaches, recurrent headaches, stomach trouble, nausea, indigestion, constipation, or diarrhea. Shortness of breath could be for some people. Sleep issues, getting too little sleep or just too much sleep. May be related to increased stress. Emotional symptoms like mood swings or anxiety, as I mentioned, depression or apathy. You just kind of just go with the flow, like whatever, just become apathetic to life. Behavioral symptoms like irritability or outbursts of anger, inability to focus and concentrate. And so, those are hard to kind of pinpoint, say that's related to stress, but these are some of the things when people have stress, they can have these symptoms. But what about some more physical symptoms? Muscle tension, fatigue, backaches, colds, shoulder pain, and even drug use or abuse could be some of those things that we see with stress. So how much stress is too much stress? Well, stress again is a physical and mental response to a challenging or threatening situation that's brought on by some stressor, whatever that is. When we're stressed, chemicals are released into our blood, causing physical changes, including, a faster heartbeat, increased, muscle tension, those kinds of things. And those can be good in certain situations, right? So if you are walking down the road and a dog got out and is chasing you, well, that's actually good. It's good to it's good to have a faster heart rate or increased muscle tension so you can actually get going. But when some of these same things happen when you're stressed about all kinds of things. And so the chronic level of stress or the chronic level of these chemicals being released into your bloodstream is harmful for you long term. So chronic stress, coping with ongoing situations like your daily job, right? For a lot of people that can be a challenge, daily job, especially now. Family, well, we all have issues within our families, and so there's some level of stress there, or relationship situations, family members or otherwise, with your maybe others within your job or your boss or otherwise. Maybe there some chronic illnesses within your own family members, your spouse or children, maybe your parents, right? Financial difficulty, which a lot of people are facing again over this past year, and then discrimination. That is a chronic level of stress that our population deals with historically. Is this chronic stress in regards to discrimination and everything that goes along with that. What about acute stress? A response to some immediate or life-threatening situation. What about anxiety? Anxiety, again, I didn't want to go into too much detail here, but there are different types of anxiety, what we call general anxiety disorder, where people are just, there's exaggerated worry and tension. Sometimes I do have patients that come in. I had a patient just this past week, and we're getting ready to take her in for surgery, and she is so anxious that her blood pressure is sky high, to the point that we were thinking that we might need to cancel her surgery. So she was so worked up for actually days prior, and we gave her some medication. I talked to her, we got her calmed down, and we were able to go in and get her taken care of. But it can really affect your body in a lot of different ways. Obsessive compulsive disorder, panic disorder. You get this sudden onset of overwhelming terror or fear for no apparent reason. For others, watching. Post-traumatic stress disorder, an anxiety disorder caused by witnessing or experiencing some traumatic event in your life. Unfortunately, that's something that we're seeing more often. Where I see that as a diagnosis, I should say. I don't treat any of these diseases, but we see that. When I was back in training in residency, that was a common finding or diagnosis in some veterans that we would take care of. And so in certain populations, PTSD is a little bit higher. Social phobia or being anxious with being in certain social situations. So having said all of that, the question is, why don't men make doctor visits, right? Because if we made regular doctor visits, maybe we could address some of these things before they get too far, right? So socialization plays a major part in men's decisions to frequent their physician. In terms of, some people just, they just don't feel like it's something that they need to do or should do. There's this idea of, big boys don't cry. We can take care of it, right? We take care of family. We can take care of it. I'm fine. I don't need to do this. I'm fine. I'm fine. Work obligations. So I got to work. So I can't make that doctor's visit. I got to work. I can't take time off to go to this visit because I won't get paid. So I can't do it. Lack of insurance. That's huge. You would, I wish I could pull in some other data in this, but this is significant in our populations and in certain underserved communities where if you don't have a job, well, a lot of times you don't have insurance, right? You end up going through maybe the local county system to try and get care. And for those who have to do that, there are a lot of, depending on where you are, a lot of hoops you have to jump through to get care. And that's partially why some of our, again, this is pre-COVID, why a lot of our ERs get inundated, because they end up doing a lot of primary care, because people are coming in when they're desperate. They've had conditions that have been going on for so long, but have not gotten care. And now they have some event related to this underlying problem that they haven't taken care of, and they end up in the emergency room. So some men decide that they will wait as long as possible before visiting a doctor in hopes that that they would get better. I'm going to feel better. I'm going to get better. So I'll just wait. And what's the biggest obstacle? Well, the biggest obstacle is not making health a top priority. And that's one of the things that I think, if that is one thing that I would leave, that I would have for you to remember, perhaps, from all of this is, I think as men, we have to, and my wife reminds me, I'm a physician, and my wife reminds me of this. You have to make health a top priority. A lot of times for me, and personally, is, I'm busy taking care of a lot of patients, and you forget, I go through, my wife will ask me, did you drink water today? And I'm so busy that, sometimes, I go through a whole half a day and I haven't drank anything. So we need to make health a top priority. What about the top excuses that men have to avoid doctor visits? I'm healthy. There's no reason for me to go to the doctor. I have no time. I don't like doctors. I'm afraid of finding out that something is wrong with me. So they'd rather not know at all. Just like I'm afraid they'll find something wrong. And I don't need to go until I'm older. So what are some steps to live a longer and healthier life? Well, some of these things that we know already. Among men, more than half of the premature deaths are preventable. So more than half of premature deaths are preventable. So get an annual physical exam with your primary care doctor. Know your numbers. And I say know your numbers, meaning, what's your cholesterol? When was the last time you had your cholesterol level checked? That you had some labs done with your primary care doctor, check your cholesterol levels. What about your blood glucose level to see whether or not you could have diabetes? You may think you're okay. Blood pressure, hypertension, the silent killer, as is known, because your blood pressure could be high and you have no idea. You don't know till things, the pressure has been so high for so long, out of control, that it's now caused damage to your body, damage to your kidneys and otherwise, which could have been preventable. Your PSA is a blood test that's used to check your prostate. There's some controversy with checking PSAs for over the years, but it is something that should be done in terms of screening. And I know some there are different recommendations when it comes to that. The discussion with PSA has to do with the idea is that elevated PSA could be for different reasons. Elevated PSA, so it's a blood test that men get. Elevated PSA could mean that it could be some inflammation or infection of the prostate. It could be an enlarged prostate. There could be different reasons, but one of the reasons for an elevated PSA could be some underlying prostate cancer. Now, again, there's been a debate on this, and I won't go into that debate, but it is still useful because even with getting a result, you have some conversation. The physician will have some conversation with you, and you undergo what we call shared decision making. So you present, as a physician, I present the results to my patients and say, hey, this is what the result is. Here's what this means. this is what we can do. And together, come up with a plan or make a decision, a well-informed decision as to what they want to do. And I think that's the way that I like to do it. And I think most physicians do. Make prevention a priority. So detect problems early. Why not find out if there's something wrong, right? Why not get that test? Because if you could take care of something early, that is the best thing to do. And ask questions. Ask your physician questions. Start early. Don't wait until you're 50 years of age to have your first health exam since high school or college. Take advantage of any free community health screenings that may be in your community or employer offered health services and benefits. Involve your family in your health. That's actually a great thing to do. I mean, you can all get on your bikes and go for a bike ride, or do things like that to involve your family and your health. And you want to be a role model for your children as well. Diet and nutrition. You are what you eat. So over 60% of American men are overweight or obese. Men between the ages of 65 and 74 have the highest prevalence of obesity. And Americans spend over $30 billion a year on diet programs. So in terms of diet and nutrition, over 60% of adult men, American men, are overweight again. And so the only truly effective way to lose weight, and this is again in general, right? I know everybody's is different, but one effective way to lose weight is to reduce the number of calories you take in and increase your physical activity or exercise. You want to eat more fruits and vegetables, whole grains, fat-free or low-fat milk and milk products if you eat that. Eliminating some of those things if you were in a whole food plant-based diet, even better, because you reduce those excess fats. Lean meats, poultry, fish, beans, eggs, nuts. Again, you can limit even some of those things as well. You want to limit your intake of saturated fat, trans fat, cholesterol, salt, and added sugars. And then exercise and fitness. Regular physical activity is the closest thing there is to the quote unquote miracle drug. So before starting any exercise program, you want to talk it over with your primary care doctor for guidance. Start off easy. You may only be able to do maybe a few minutes per day to start off with, and then be able to increase that over a period of time. Exercise at least 2 times per week. Any kind of activity, even going out and mowing the lawn or washing your car or walking the dog, is better than none. We got a dog about maybe a year and a half or so ago, and since he's a big boy, he's an Italian Mastiff, a Cane Corso, so he's a big boy, and he makes us go for walks because he needs walks. He needs to go out for a walk. So we try every day, morning and evening. We try. It doesn't work out every single day, but to take him for a nice walk. So with doing that, we're getting some exercise as well. And I'm trying to be mindful of time to leave time for some questions here. Prostate health, early detection is a key. Prostate cancer, again, get a baseline prostate exam, say by age 40. It says or earlier. I don't know if I necessarily agree with earlier, because you really don't need to do that. But 40, if you have at least 2 people within your family with prostate cancer. I think other than that, 40 might be a little early, but at least at age 45, if you have a family history of prostate cancer, maybe from about that time would be good to at least just get an initial screening. Ask your healthcare provider about other prevention tips. I mentioned BPH, which is progression that can be slowed or stopped if treated earlier. I did mention prostatitis, which is the inflammation of the prostate. Cardiovascular disease, again, that's referring to high blood pressure, coronary heart disease or hardening of the arteries in the heart, and stroke. Simple steps you can take to protect yourself. You have get regular physicals, try to lose some weight, choose a healthier lifestyle, get into regular exercise routine, limit alcohol or caffeine, reduce stress, quit smoking. These are general things that we talk to patients about. Diabetes, of course, trying to lose weight, getting more exercise, control blood pressure, eat healthy. I think you see the theme. I keep almost saying the same thing for each of these, but there is a common theme here. Cancer, recognize the risk factors. Smoking. If you have family history of cancer, you're 55 or older, history of cancer in the past, you're at a little higher risk. Early detection is a key. Notify your doctor if you notice anything unusual or abnormal, and you want to reduce the risk. Again, in patients in general say, cut back or no tobacco, eat a healthy diet, stay active, wearing sun protection. Depression, treating depression starts with yourself, getting exercise, spending time with other people, doing things that you enjoy, prioritizing things, setting goals, be patient, but you need to speak to a physician. If you feel like, hey, I may be having symptoms, you need to talk to someone to be properly evaluated for this, to see if there are things that can be done to help. And then again, some of the same things, coping with stress, some of the same things we talked about: exercise, eating healthy, eliminating caffeine, getting enough sleep, and trying to relax. And so again, the trend that we've seen is you should see your doctor regularly, ask questions. The trend we're seeing is eating healthy, exercising, protecting yourself from the sun, maintaining a healthy weight, getting a good night's sleep, managing stress. And I think that we are at the end. So I will stop here to give a few minutes, I guess, here to answer some questions.
All right, sounds good, Doc. I have a few questions here. Some I've noticed that you've answered, and these are some questions from our online audience. Let me read one here. It says, is the PSA good enough compared to a digital exam?
You need both. So you need a PSA and a digital rectal exam. The reason why I say that is the PSA, like I said, could be elevated for different reasons. The most concerning reason is prostate cancer. But what the digital exam will do is, when we feel the prostate, we really feel for any abnormal areas within the prostate. So an example, as I was saying that, I was thinking of a patient that I took care of a few years ago. He had a family history of prostate cancer. His PSA actually was normal. I did a digital rectal exam. His prostate felt abnormal. I biopsied his prostate and he had prostate cancer. Okay. He went on and he decided to go on and have surgery, which was probably the best thing for him, because I think it would have affected him over his lifetime. Because if we were just following PSAs, this thing would have, at some point, it may have progressed. By the time the PSA got abnormal, it may have been an issue for him. I know that's a unique example, but that's one of the reasons why you need to have both. You need to have a PSA and a digital rectal exam.
Okay, good. And this one you've basically answered, but the question is, what if there's a family history of prostate cancer? What age should you recommend screening? And you did say 45.
Right, but probably about 45 or so is a good age. See, for men in general who have no family history, starting screening around 55 is kind of what's recommended. And so someone with family history, so first degree relative with prostate cancer, your father, an uncle. I even have patients whose their grandfather had prostate cancer, their dad had prostate cancer, and an uncle, and so strong family history should get screened. And you can tell your primary care doctor that, because you may be discouraged. Well, you don't need a PSA. Well, you know what? I have a family history of prostate cancer. Can I at least get a screening test to start? So I would say at least probably by age 45 with a strong family history. At least if you have at least a couple people in your family, first degree relatives with prostate cancer, that's a good age to get initial screening.
Good. Okay, I just have another question that popped up again here. It says, can a check for polyps replace a physical prostate exam?
No, because what they're doing is, I believe that the question is referring to getting a colonoscopy or sigmoidoscopy, which is recommended after you get to a certain age. They just look into the colon to check for any polyps or cancers or anything like that. that does not suffice for a digital rectal exam because that doesn't feel the prostate.
Okay, good. Now, what about males? Make them more susceptible to some disease. Sorry. And a second part of that question is, why is it that African American are even more susceptible to some disease? Is it something about the genetic makeup? Is it something based on previous,
Ian, thank you for that question, because that was a question I was dying to answer.
Okay.
Yeah, I don't know if I will give a sufficient answer, but I will try. It's interesting because, like I'd mentioned, one of my colleagues some years ago had shared some of that data. I'd mentioned looking at some of the data coming out of LA County, and when they had looked at rates of death, and even when they factored that, using statistics to rule out certain things out of the numbers, or take certain things out of the numbers, they still found that African American males died younger than any other population. So when he had shared that, he had shared that, I think at a church service. When he shared that, I start wondering, like, why is that the case? There has to be a reason. If you rule out, you factor out everything else, African American males. So there has to be some underlying reason. Now, is it issues in regards to access to healthcare? I mean, I think that probably plays a role to some degree. In having insurance and going to get checked, some of these same things that we talked about. Because if we get checked early, maybe some of these things we could treat early and doesn't progress. Well, the other thing is, and what I'm going to say is it's probably going to be a little controversial. This is just kind of my own thoughts, but it may be a bit controversial. So there's this idea and this area of science that we call epigenetics. What epigenetics is the idea that there are certain things that influence our genetics or the expression of our genes, right? And so many years ago, it was thought that our genes, the things that we do that affect our own bodies, that it would not have an effect on, say, our offspring, our children. So I haven't looked at this data in a while, so I'm going to give you some general information with that. And I hope I'm not too long with doing that. But there is data going back, looking at, for example, during World War II, when the Nazis had invaded. And I'm trying to remember which country it was, and I don't remember. But anyway, I think it was the Netherlands. They were coming in from the south. They were also coming in from the west. Mm-hmm. There's a lot of waterways in that area, and what happened is, and then in those waterways, some of it, because it was during winter, part of it froze over, and so there was the population was not able to get food. So Hitler basically starved a lot of people, okay? And what ended up happening was there were individuals who survived that terror. And what they found was the offspring of those individuals to this day have health problems, increased health problems compared to general population, okay? Levels of like diabetes and other things. It's actually dramatic. There's data because they have actually really good data on it. So that was actually quite striking to me. There was another country where they actually have really good records, and it had nothing to do with war or anything. But in this particular area, it was a farming community in Europe. And one of the things that they found was there would be years where they would have plenty. And the people were really gluttonous. They would just eat and eat, because there are other years where it could be almost famine, okay? And one of the things that they found, and this is actually, it was the observation of this that came up with this initial idea of this epigenetics, this idea of epigenetics, where things within the environment, whether it's what we eat, whatever, influences influences how our genes are expressed. And so What they found was the offspring, they followed these individuals, and the offspring, for the folks who were very gluttonous, their offspring had a lot higher rates of medical problems again. So again, that was the initial observation. And so it sort of made me think. And again, with me saying this might be a bit controversial, but I don't have any data to necessarily support this statement. But with all this other data coming out by observation of other populations, one of the things that I thought about is that due to slavery, with generations of slavery, some suggest probably about maybe at least 8 generations, and then not only after that, issues in regards to discrimination, financial security, all those kinds of things. All of those things come into your overall health.
Sure.
And so my thought is that, and again, there's no data that I have. This is something I've been thinking about over the last few years, is that I believe that has some role to play in what we're seeing now, because what happens now is just compounds. So for example, if you think of, say, during slavery, not good nutrition, so you could have developed, hypertension because of stress, absolute stress, diabetes, all those things. That gets passed along to your children. So one of the things that they found in this idea of epigenetics is that changes that occur in our DNA that we, from what we've exposed ourselves to, that actually can get transmitted to our children.
Wow.
So that actually is something that they have observed. It could get passed along to children, but what the good thing is, and how merciful God is that if certain things are changed, the lifestyle, those changes can be reversed potentially. So that's how wonderful God is. But I look at the generation. So you had generation of, say, slavery with compounding issues from generation to generation to generation. I see that as a possible explanation, in addition to all the other things, like not good access to healthcare, insurance, all those kinds of things, that just perpetuates this challenge that we have in our population, where even when you exclude all these different factors, men still die at higher rates in LA County than other individuals. Like, there has to be a reason. And so it was after that as I was going through and thinking and researching and reading books in regards to epigenetics, and I've given a couple, 1 or 2 presentations on that, that I think that it may be playing some role. So I don't know if that answered the question, and I don't know if that's the answer to the question, but I think that it does play some role.
I got a question for you though, Doc.
Yes.
I wonder if there's any data out there that compares men from the continent of Africa to Afro-Caribbeans and Afro-Americans, and to see what's the role of prostate in those individuals.
Yeah.
I think that would be because us Caribbeans and African Americans have more of a similar type of story, I should say. So, is there anything out there like that compares?
Yeah, I haven't looked at any recent data, but in the past I did. One of the things that we could see in terms of incidence of prostate cancer is probably similar in the Caribbean and maybe in Africa. The problem is there's not good data collection. One of those problems, at least in the past, is there's not good data collection in the Caribbean and in certain parts of Africa. There are men who have disease that they don't know because they don't go to the doctor. So I don't know if we know fully the current state of things. Things may be better now, but one of the challenges that we have, and I'm from the Caribbean, is I know that it's hard to get a guy to go to the doctor, unless something is really wrong, and so that's a challenge. And so I think it's attitudes that we have towards healthcare. And I know some people are a little reluctant, historically about healthcare and so forth, but it is actually a starting point. And so I encourage folks, if they haven't seen, of course, with COVID going on, we have been sort of restricting folks from coming in, and we're doing a lot of virtual visits and all those. Even if you do a virtual visit with your doctor, that's better than none at all. So I would encourage you if you haven't, seen or spoken to your doctor in the last year, try and set some appointment up sometime this year to be seen. Hopefully, you can do it virtually while we're still going through this pandemic, or when things improve. So again, I don't know if that answered your question.
Yeah,
Well,
I have one more question. I don't know if Elliot, you have one, but I want to ask one real quick.
Go right ahead. I have three. Go ahead.
So in terms of the prostate cancer, what are some things that we can do to help lower our chances? Now, you mentioned diet, change of lifestyle, but if this perhaps is somewhat of a genetic problem, is there anything that we can do to help lower the risk?
Well, I mean, for some men, it's a genetic issue, and even with white males, if they have a first degree relative with prostate, they're high risk. Okay. For prostate cancer. So, I think that part of it is just the awareness of getting screened early. That's part of it. Definitely, eating healthy, lowering your fat intake. Obesity is, one of those things that from studies in the past, we've seen that men who have a lot of belly fat may be at higher risk for even more advanced prostate cancer. And so we know that there's something there. I don't know if we know all of the answers there, but genetics plays the major role. But some of these other things in regards to just overall health, getting exercise. So for example, I'll give you an example of something. There is, I believe it may have been Dean Ornish. You guys may have heard of that name before. He does a lot of presentations on healthy lifestyle and so forth. I believe he had done a study, this was some years ago, where they looked at, DNA. So I don't know if you guys have seen pictures, of course you've seen pictures of DNA. You took, biology maybe in high school or in college or otherwise, and you've seen these pictures of DNA. It almost looks like an X, right? You kind of see a picture of the DNA that's coiled together. Well, at the very tips of the, so you see the DNA looking like this, at the very tips are what we call the telomeres. There's a special name, it's called telomeres. So the telomeres, it's interesting, where the longer the telomere, that may correlate to longevity, to longer life. And one of the things that they had found was, in this study, was with this diet, and I believe that the diet was kind of a whole food plant-based. I believe that's what it was. Again, haven't looked at the study in a while. What they found was that the individuals that had lived a healthy lifestyle, they had longer telomeres. So
I need to check my telomeres out
with a longer lifestyle, a longer life expectancy rather, and I'll throw this one out as well, because I know there's some women listening in as well. So this, again, a study from many years ago. There's a website called nutritionfacts.org, and they have a lot of interesting things on there. One of the things that I'd seen from several years ago was a study that was done where it was a simple study. They looked at two groups of women. So they had the what they call the control group and the intervention group. So the control group are the individuals that have no intervention. So the intervention in this particular study was essentially a whole food plant-based diet. So that's what they did. They had women eat a whole food plant-based diet, and I forget for what period of time. If it was a short period of time, it's like 2 or 3 weeks. It wasn't that long. And so what they did was they took the serum. So they took the serum of these women, and they mixed it with breast cancer cells that they grew in the lab. Okay, so they grow breast cancer cells in the lab to do all kinds of research. And one of the things that they found after this short intervention of just dietary changes was that and they saw definitely some changes within, certain, labs that they drew. They saw different changes of the women who, of course, did the intervention. But what was even more significant was when they took the serum and they grew it they put it with the breast cancer cells. The blood of the women who were on this whole food plant-based diet, their blood was so inhospitable to the growth of cancer that the current cancer growth was low, and compared to the women who didn't undergo the intervention. To the point, I think the numbers were as high as, I think it reduced it somewhere close to like 70%. I mean, fairly significant.
Wow.
So, the power of diet alone is huge. And I think there are little studies that have shown this over a period of time. And we know this, within our belief system, we believe in healthy eating. We have the health message, so to speak, right? And I think we've taken it for granted because it's kind of, for some of us, maybe we grew up with it. Some we got exposed to it later in life, but it's part of. I think it's just become so commonplace that we don't think that it makes a difference, but it does. I know you guys have heard of the blue zones, right? You've heard of the term blue zones. Well, it's areas around the world where longevity is high compared to the surrounding populations. Well, one of the well-known blue zones is Loma Linda. Loma Linda is a blue zone, and there's certain other parts around the country. I think there's one in Japan and other places. So, and it's because there are a number of high population of Adventists that live in Loma Linda, and ascribe to a different lifestyle, and diet has a lot to do with that as well. So, again, I know I went a bit long with that, but hopefully that answered your question.
Yeah, I know we were short on time, but I have 3 quick questions here. Just want to make sure that I ask the fact that the online audience asks them. So one question is, and you kind of touched a little bit on this, but it says, are African American males more susceptible to disease than people from Africa, and why? If so, could it have anything to do with the Middle Passage?
I don't know if I know the answer to that, if we're more susceptible, but I mean, because again, there are probably some changes that has occurred over a period of time. The changes in terms of genetics, though, again, this may have to do more of the idea of epigenetics, and I don't know if there's any evidence that we can actually come to some conclusion on that. So I don't know that answer. I don't know the incidence of certain diseases within Africa compared to, say, African males compared to African American males. One thing that I will say, though, is we know that there is evidence that when people come to the United States, so for example, you have folks that come, from Japan to the United States. In Japan, they were eating very healthy. They come to the United States and they adopt the American diet and lifestyle, and now their incidence of certain diseases increase. So we know that the American diet is harmful. The average American diet is harmful. So, we could potentially make that correlation to say perhaps, we have probably increased level of disease, probably because of our lifestyle and diet here in the United States.
Wow. Okay. Quickly, this one, I'm not sure if it's a question or a statement, but it says here that epigenetics proves the effect of behavior and trauma on generations and disproves the thought that negative or destructive behaviors are intrinsic to any group.
So yeah, it's interesting. So I'm not a psychologist, psychiatrist to know those that level of detail. However, I have seen where, yes, they have seen where, so in terms of epigenetics, in regards to what was referenced there in that question or statement, that yes, that can be passed along to offspring. And so besides the issue of trauma, again, we're also, what I was suggesting was perhaps that other things in regards to other aspects of health could be passed along potentially, but not just one generation. Remember, slavery was generations, so it was just perpetual, and still getting to the point now where people are still having issues in regards to access to healthcare. I mean, one of the things that has been observed too is, even there's with there's higher rate of I believe with miscarriage in African American women compared to other populations. Why is that? I mean, there are all these different things that have been observed, and so I think we may be getting more information as time goes on. But remember that our populations have not been, we have not, as the data shows, gotten good access to healthcare in general. Again, I'm making generalizations here. Those of us who have jobs, we have healthcare, so we should utilize that. But remember that there are many out in our communities that don't have access, and so some of them may not even know their family history as well. So that could come into play in terms of familial diseases. So hopefully that answers the question.
Okay, and I have a rated MA question here. It says,
okay.
Since there seems to be a correlation between STDs and cancers of the head and neck, would you advise against performing oral sex on an individual with an STD?
Well, so what I was referring to is not the I think it's up to the individual what they decide that they want to do. But with the STD, it's really related to viral, not chlamydia, gonorrhea, not HIV. There are women who are at high risk for cervical cancer related to viruses, and it's similar viruses that may be related to developing head and neck cancer. So when I was saying that, I was referring to specific, not the HIV, not the gonorrhea, chlamydia, but just mentioning one of the things that my colleagues had been telling me in regards to some of the observations over the last few years.
All right, and this will be the last one, I promise. This person said, hey, don't forget my question. It's a little bit, yeah, we didn't go much into this, but it says here, is it safe to take COVID vaccination?
I don't know if that's something that I can give you a great answer on. I would say that I think it's up to the individual to decide, hey, is this something that I do want to do, looking at the research. COVID-19 has decimated the world, and right now, if you as the push is being made here in the United States and around the world in terms of vaccinations, there are at least a couple vaccines that are out there. You guys heard the Pfizer and the Moderna, and these are what they call messenger RNA vaccines, where this is injected, is what we call a messenger RNA, which is basically a code. So you can think of it as a code that's being injected into the body. That code is then utilizes the machinery within our own cells to produce a viral protein. So this code that's injected utilizes the machinery in our bodies, that the machinery within our cells that make proteins in general. It goes and utilizes that to code for a protein. And this protein is actually on the surface of the coronavirus. And so the idea is if you get the vaccine, that, and it sounds like it's a couple doses, right? And people are going back and forth with that at this point in regards to, is there going to be enough to kind of go around, even with couple doses, that they found that after the second dose, maybe there's a little better response. So the idea is that the vaccine will cause our bodies to make this viral protein, which is considered that the immune system to our body will see as foreign, and will develop antibodies to that protein. So that's the idea with the virus. I mean, with the vaccine, sorry, is that it will allow your body to produce antibodies, so that if you do encounter coronavirus, that your body is already primed with these antibodies, that if you get infected by it, the antibodies would help neutralize the virus. I think that the thing with it is, they had done the studies very quickly, and part of that was, the explanation was because they had a lot of money to actually run concurrent studies, right? So they did, usually it takes a long time to get any answers, but they were able to run concurrent studies, so they got a lot of information really quickly. I think the thing that we don't know is, we don't know the long-term effect, because this is new, right? And I think that's concern for some people. But we just don't know over a long period of time, how I think we're going to learn or find out how long this actually vaccine, if you get it, how long it lasts. So I think it's up to you. You got to determine if that is something that that you want to get or not. There are many people dying in the hospital. The numbers are a little better, I think, this week. Overall, but you guys have heard the numbers throughout the United States since this started. Over 400,000 people have died in the United States.
Amazing.
And so, I mean, that's tremendous amount of people. And you may think also that, maybe a disease or infectious disease that will just affect, because in older individuals, because in the beginning there's young people, whatever, but there are young people that have died from COVID-19, young people who have been affected by it. I remember a lady that I'd worked with, and she had mentioned that her son, who was in his 20s, he was on a ventilator in the ICU for almost a month. And he finally was able to get off the ventilator, but then he couldn't walk because his body was so deconditioned that it took time. And hopefully by now he's able to walk and get up and move around, but he was in his 20s, right? Other folks mentioned to me just recently how people they know who are in their 40s and even early 50s have died just in the last couple of weeks. So it's serious, it's real, it's serious. And I think you have to make a decision as to what you would want to do. The risk of getting the risk either way of getting coronavirus. For some people, they get mild symptoms and they're okay. And some people don't do as well, versus potential things that we don't know about, the vaccine over a long term, because again, we don't know over a long term if this is going to be effective, or if this is something that maybe you have to get booster shots. Who knows? We don't know. I think time will tell.
And if I may just add to that from a pastoral perspective, maybe for those who are listening, there is no official stance from the Seventh-day Adventist Church that is, saying whether people should or should not take the vaccine. It's a matter of conscience. And so I don't know what myths may be going on, but there is no stance within the Adventist Church that says that people should not get vaccinated.
Yeah.
Right.
Individual, like you said, individual choice.
Right. It's an individual choice.
Yeah, individual choice. And I'm just take a quick step back in regards to the comment going back to STDs. You guys have probably heard of HPV, or human papillomavirus.
Yes.
So that's the virus in particular that we referred to in regards to head and neck cancers and cervical cancers and that kind of thing. That in particular, I was referring to in terms of STDs. Okay, I just want to clarify that.
All right.
All right, Dr. Maynes, I know that you are a very, very busy man, and I just want to thank you so much, for consenting to do this program. We really do appreciate it. I do appreciate it. I know the pastor does, and our church and the online audience. And I thank you for doing us. At this time, I just want to ask if Pastor Winter will just pray over you, pray for your protection as you continue to work in the medical field. We know that COVID is a hot spot there in California. So, we want to pray for your protection, and not just your protection, but the protection of your family.
Yeah.
And that the Lord will just bless you and shelter you and your family as you continue to do your work and his work. Pastor Winter?
Sure. All right. We want to thank you again on behalf of the Boston Street and the New Community Church. We want to say thank you for sharing this wonderful information. It was indeed a blessing. Let us pray at this time. Father, we are so thankful for this wonderful opportunity where we can help our men, and especially the congregations in which we are serving, Lord. We seem to be at so much more high risk. And Father, we don't know if it's because of the trauma we have experienced due to slavery and the various experiences that we have had. But I want to pray, God, that you may help our people to become more informed. Help us to do the best we can as churches to give them the tools that they need in order to be healthy. I also want to just pray over our doctor today. I want to thank you for bringing him here and blessing him in such a way that he can share this information with us. And so, Father, I pray that you may protect him as he is out in the field as a first responder, that you may keep him from any disease or viruses that may be airborne. And we just pray that you may continue to keep him safe. Thank you for our viewers today and those who have tuned in into our program. We bless your name. It is in Jesus' name we pray. Amen and amen.
Amen.
Amen. All right. Thank you, Doc. And this brings us to the end of our session. Next week, we will have another session, but that information will be going out. All right. Be blessed.
Thank you.